Hello friends, let us now learn about the differential diagnosis for these. First, it shows ST segment depression with inverted T wave in V5, V6. This is seen in digoxin toxicity. In digoxin toxicity, we see ST segment depression with inverted T wave in V5, V6. Then small T waves, prominent V waves and ventricular bigeminy small T waves is seen in hypokalemia, whereas tall tented T waves and ST segment depression is seen in hyperkalemia. Then short QT interval is seen in hypercalcemia. Prolonged QT interval is seen in hypocalcemia. ST segment elevation is obviously seen in myocardial infarction. Saddle shaped ST in all lids except AVR is seen in pericarditis. Saddle shaped ST segment is pericarditis. V wave, obviously it is hypokalemia. Delta wave is seen in Wolff-Parkinson's White syndrome. Then J wave is seen in hypothermia. We see J wave. Thank you for watching.